right, welcome. This is our Always Shine Your Light educational series. My name is Kay Aubrey Shemaine. I'm the owner and director of Grand Adventures Ranch. We have a holistic equine wellness center in Sonoita, Arizona, which is south of Tucson in the mountains. And tonight we're going to go over a little bit about what you should check in a pre-therapy session evaluation. This comes up a lot. It's one of the things that I find a lot of my students have really never done. They just jump in and start doing rather than checking the horse for balance beforehand. So we're going to just do a little bit of an overview of the sort of things and the sort of ways and the tools that we use to evaluate a horse even before we scan the horse with a photopuncture scanner. Yes, the scanner is going to tell us exactly where to treat, but we want to set our intentions beforehand on what we're hoping to help bring back to balance. So, evaluating a horse before and after each session is really critical. One, you need to know where the horse is out of balance, partially for setting your own intentions, and I think that's a whole nother webinar, but intention is so important to our outcome. And also, because if you don't know where you start, you can't show that you've made any changes or improvements, even gradual. And most owners will never notice any improvements unless they've been quantified, they've been pointed out. This horse turns their head more to the left than they do to the right. This horse is high in the right hip as opposed to the left hip. If they see it and it's pointed out to them, they're more likely to notice after that that a change has happened, that things are better. It always amazes me. Owners who've never noticed that a horse has fat rolls, or owners who never noticed that one foot is completely a different length than another. We just go on and because it happens so gradually, we don't see it. So a pre-session evaluation is critical. And we always think of evaluation in 4 stages. We look, listen, smell, and touch. We use all 4 senses when we're evaluating a horse. I always start by standing back from the horse, taking a macro view, looking at the horse overall. Is he different on walking all the way around? Is he a different color one area or another? And not just because he's a multicolored horse, but because maybe his hair is orange and fishhooky over the barrel, which is a mineral deficiency. Or maybe he's bruised, or maybe he's swollen in one place and it's visible and you can see it. Or his coat changes. If he's recently pooped, what does the manure look like? Is it dark and dry and hard and too high in protein? Or is it wet and sloppy? Is the cornet band even? Is just overall macro things that you could pick up? Do you see scars? Do you see a horse always putting the weight on one hind foot instead of the other? None of these are a diagnosis. They're just information that's going to give us more ability to affect the outcome. Okay? And I always look first standing, then moving the horse away from me and toward me at a walk, and as long as they're not limping, as long as it's not painful for them, at a trot. I work very hard to get directly in front of and or behind the horse when they're moving. I want to see, I'm looking for balance here. Is it the same on the left as on the right? If you're using balance as a guideline, then something like a Peruvian Paso with their crazy front action won't throw you off if the action is the same on the left as it is on the right. If they're termino and paddling that foot the same side to side, that's okay as long as it's in balance. Are they moving are they moving straight ahead, but their hindquarters off to one side, so they're side paddling? Are they, you can pick up a lot more Is one hip bouncing up higher than the other when they're moving? All of this sort of information gives us more feedback, gives us a better feel for where that horse is when we start. Listen, and not just to what the owner has to say or the handler has to say. Listen to the horse breathe. Is it even? Is it steady? Listen to their gut sounds. Do they have gut sounds on both sides? And I may not check gut sounds on every single horse I ever see, but if your brain kicks in, check the gut sounds, or you know this horse has a history of colic, or they're seeing you because of colic. Boy, get that ear up and against the flank and start checking gut sounds. And then listen to the owner and or handler. I always try to actually have the person who takes care of the horse all the time available for the first time that I do a horse, so that I get a good idea of what the history is. They may be full of all kinds of crazy ideas, but they're going to know that horses change better than anybody else. If a rider tells me he's off, I don't know why, but he's off, I'm going to believe that something has changed. I can't tell you how many times I argue with veterinarians who don't want to listen to the owner. They just want to look at the horse. But I get a lot of information from the owner. Then we move to the nose. Let's smell. And this is a crazy one. People are like, what do you mean you smell the horse? But toxic horses smell bad. If you're a few stalls away and you can smell when a horse down the row has pooped or peed, there's an issue. If a horse is toxic, even going up near them may smell bad. If they're really, really sweet, could be diabetes. Okay? Could be all kinds of insulin resistance issues. If their urine has a lot of ammonia in it, that's a big flag. Not that you need to diagnose the horse, but you have to know there's an issue and maybe say, yeah, no, this doesn't smell right to me. You might want to talk to the vet. Or if you feel comfortable going into toxicity and detox work, talk to them. Or point out that doing a photopuncture session or an energy session can release, you can specifically do a session to release a lot of toxins and help free up a lot of the issues this horse has. Toxicity can cause a whole lot of other problems. So just take note of what do you smell. And I put this on my evaluation chart. Did I smell anything? And here I am smelling the horse's nose, the nostrils. This particular horse smelled really rank. So we were pointing it out to every one of the students. When he breathed out, he was rank and got in there and he had a bad tooth. So that's another clue. Bad smelling mouth might be a rotten tooth. Nobody noticed because he's just been standing in a stall, hasn't been ridden, nobody stuck a bit in his mouth, so they weren't paying attention to the fact that he had an abscessed tooth. And then touch. And you don't have to end with touch. You can start with touch if you want, but I usually end with it. And I encourage my students to close their eyes, take both hands, start right behind the pole, and just slide along the horse, ever so barely touching the horse. Palms just along the horse, generally following the bladder meridian, but just running along the horse. Where do we feel heat or cold? Where does the hair change texture or get sticky? Where does the energy stick? Tells you a tremendous amount about the horse. Do you get stuck over the kidneys, or is it hot over the kidneys? Closing your eyes is one of the best ways to pick up on temperature changes and swelling and knots. I loved closing my eyes when I go over a horse. And then opening them and looking for scars and knots and cuts. Looking at the cornet band. Is it in balance? Okay? Is it even? Is it the same from foot to foot? Does it have little holes in it? And just going all the way down the horse and checking these things is really important. We check for balance in a couple of different ways. One is using anatomical landmarks. We always go in right behind the pole and see, with the horse's head facing directly straight in front of him, do we have the same amount of space between the back of the jaw and the flange of the first vertebra on either side. That tells us if C1 is in position. We check side to side. In other words, I'll stand way in front of the horse and see, is one shoulder of the horse more developed than the other? Or I'll take my hands along the neck. Is one side of the neck lumpier or more swollen or more muscled than the other? That tells us about what's going on with muscle development. I'll do the same thing from the hindquarters. Is one hindquarter more muscled than the other? Do we have some atrophy? Hips, and I'll show a picture here of this in a minute. We always check to see if the hips are in balance, both vertically, are they at the same level height-wise, and horizontally, are they both at the same level toward the ears? In other words, are they in alignment? And then I reiterate about the cornet band. And when you start getting into acupuncture points, remember that every acupuncture meridian either begins or ends at the foot, the hoof, and those are ting points. And so when you have blocked energy in a meridian, it will often show up, if it's been there chronically a long time, it'll show up as an imbalance in the cornet band. If there's not enough energy in that meridian, the cornet band may stick up. If there's too much, it may divot down. So it's just an imbalance. It's just a way to keep track. We also check for balance by doing stretches. Does the horse's body stretch evenly from side to side? Now this is a neck stretch that I do, and I usually put one hand up on the neck, like I've got my right hand here right behind the pole, and I've got just two fingers. I'm barely pulling on that halter. How much will that horse turn its head willingly with very little pressure? And will they do it the same on the left as they do on the right? And that's going to tell me a lot about the neck. Okay. Here we are checking for balance on the hips. You can see in the little picture on the right, we've got two people, one on either side of the horse. And we've just taken our palm and slid our palm directly toward the hip till it is stopped by the hip bone. And then we look straight across. When we first started with this horse, one hip was, a good inch and a half in front of the other. Now I do usually line up the hindquarters. I ask the horse to stand as square as possible in the hindquarters before we do this. And if they can't stand square, that's a clue, right? That means it's not comfortable for him. But if he stands square and then we do this check, we can see, is one hip forward from the other. We don't know which one is wrong. It might be locked forward, it might be locked back. We just know they're not in balance. And then we'll go stand behind the horse and look and see, are the ischiae, the hip bones, at the same height on both sides? And if it's hard to see, I'll have my two volunteers just take their hands and lay them flat on the top of the hip bone. And the person in back can then evaluate it. Obviously that takes more than just two people working on a horse. And then we do more stretches. I love carrot stretches. Much like just doing the little two-finger pull on the halter, it's what the horse will do willingly to the point of pain, and he gets a reward for doing it. So we do a lot of carrot stretches. We do that neck knot release like you just saw. And that little, what says there, pull below the withers, when you do those neck stretches, you want their head down to where the pole is no higher than the top of the withers for that stretch. It's going to give you more information. It'll be less painful for them. There are those giraffe horses that just don't want to do that, but our end goal is that a comfortable horse, their poll is below the withers. We'll do leg stretches, stretching them, both the front legs and the back legs. Does each leg stretch the same amount as its sister leg on the other side? We'll do back lifts, where we come down and run our fingers along the belly and ask them to lift their back. Will they do it? If they absolutely refuse, maybe we have some chiropractic things going on. We'll do butt crunches. If you don't know those, you need to come take the class. But butt crunches, when they tuck their butt underneath them, does it tuck equally on both sides? Do they use their hindquarters evenly? And here's an example. The top picture is just stretching the front right leg back. We always do front and then toward the back. And then there's an example of a carrot stretch there. We're actually checking C2. Can the horse lift his head up with that carrot stretch? And if he is chiropractically out of alignment at C2, he can't lift his nose that high. So this is the sort of things we go into for checking balance. You get to where you can do it very quickly, no more than 10 minutes per horse. But this will tell you a lot before you go into your therapy session. If you want to come, this is part of the class that we teach. A big part of our CPT class and Torchmaster classes is evaluating both before and after. And then, of course, documenting what you find. Question?